Welcome back to the Bright July podcast, brought to you by Luxy Health and proudly sponsored by Zeiss and Essilor Luxottica. This is part 2 of my conversation with Associate Professor Pauline Kang from UNSW, Sydney. If you haven't listened to part 1 yet, go back and start there. Now let's continue. Yeah, our understanding around myopia has evolved very quickly, and alongside that, the treatments that were available to clinicians and patients, and it's been it's just been moving so quickly, and it's really exciting to be able to offer treatments to patients to slow down myopia once it's started. I remember as a clinician years ago, we had nothing. We just had to sort of try our best, and even with what was available, sort of the efficacy rates weren't that high, but that's all we could rely on. Say, if I'm talking to the clinicians out there, bifocals, progressive lenses, prism type lenses, but it's changed a lot, within the last 5-10 years. So the myopia control glasses, they've become more mainstream and more accessible. And what can you tell me about the efficacy rates of these lens designs and how they sit alongside the other myopia treatments that are available to us now?
Look, yeah, so as you mentioned, like particularly in the past, few years, the amount of different types of treatments that are available to clinicians to prescribe to our patients has increased dramatically. So even when we were training, John, we were probably taught just you need to correct the vision, don't worry about the underlying progression. It's just making sure that the patient has good vision. But it's obviously evolved now to not only provide the patient with good vision, but we need to try to slow down the progression. And spectacle lenses is a really good option because we need to provide the child with a correction so they can see in the distance, which the glasses already provide, but they have these treatment zones within the glass lens design that has been shown to, slow down the progression of their short-sightedness. And so, lots of different designs that are available. And I think, if you want to sort of just look at the evidence as a whole, understanding that there are lots of different designs that have been tested, most or all of them have been shown to slow down or stop the progression of myopia, which is really, really positive. And, there have been very little studies to directly compare between, different types of myopia control treatment. So when you look at, for example, glasses to contacts or glasses to eye drops, but when you sort of look at the data as a whole, I think most of the studies do show that they're all sort of relatively on par with each other, which is good. But in saying that, we're getting more research, better designs that are coming out that are showing sort of improved treatment effects. But some of the earlier studies that did try to look across the different types or modalities of treatment had shown that they're all relatively on par with each other. So, but glasses, I think, it is a very good option to provide patients, only because you have to provide them with glasses to be able to see anyway. So to have the additional treatment zones to provide that extra benefit of slowing down their myopia progression, I think, is the added benefit of that. So I think at the moment it seems like like all the myopia control specs that have come out, they do have positive treatment effects, which is good.
Okay. And just kind of thinking back to my days as a clinician seeing parents, parents come in and they ask for advice. They always want the best for their child, and they may do their own reading and heard of a new lens has come out. Now, it's great that they're excited and doing their own research and knowledgeable, but also, I think that discussion with the clinician, making that decision together, sort of trusting the process a little bit. Just because there's a new lens out doesn't mean we have to immediately jump to the next lens. Also, the other thing that I sort of would come across as well, combination therapies. So child might have spectacle lenses and they might say, my friend is putting eye drops in as well. Do we need to do that? Now, that's where we have to put some trust and faith in the clinician. Every situation's different. Every child's different. So, what do you have to say about these different approaches? And, it's changed a lot and they are available to us. But to the parents out there who might be a little bit anxious and they always want the best, they might see that number creeping up because, as we understand now, there's no treatment which is 100%, ethics, right?
Yeah. And also, it's hard to be able to predict exactly what treatment might be the best for a particular child. We know that there might be some factors within patients that might, where studies have shown, for example, maybe younger age children might respond better to a particular type of treatment, but, the findings can be sometimes inconsistent. So, as you mentioned, John, when parents speak to clinicians, they would often not only look at the research studies to understand how well the treatments are working, but it's also based on other factors as well, like lifestyle factors, how well the child will adhere to treatment as well. So just because another child's doing a particular treatment doesn't mean that it's going to be the best option for your child. It's very case by case, as you mentioned, and how the child will respond to treatment as well can be very different between one child and the next child too. So that's why it's really important for parents, once the treatment starts that they keep going back to the optometrist or eye healthcare practitioner to ensure that you're monitoring how well your child is responding to treatment. But yeah, I guess the optometrist or eye healthcare practitioner should be able to hopefully talk or discuss a couple of treatment options where the treatment will be, I guess, an option for your child, because some treatments also might not, your child might not be eligible for as well. For example, if you've got allergies to some components of the eye drops, and you might not be able to use that. If your child might not have the motivation or the maturity to use contact lenses, and that might not be an option for you to consider right now. So it's really discussing all of those different factors with the clinician, and then sort of determining what treatment option might be best for that particular child. So it's very individual, and yeah, it's with a lot of discussion and consideration with the clinician and the patient. You've got to consider what your child also wants to do too. And then you sort of make a joint decision as to what you think might be the best option moving forward.
Yeah, and I think that's an important point. The treatments are only as effective as the compliance to that mode, to that
Yes.
method. And I
Yes.
think, a lot of the time when I spoke to parents about, which way we should go, it really was around understanding that. Um, and, that would be the most successful one, the one that made the most sense, and the one that would have the most traction with that group. So really, when I used to think about it as well, it's not just the child, just the patient, it's also the parent, because they're the carer and they're involved with that care.
Yes.
So kind of coming to that, consensus as a sort of a group to see what
Mhm.
best for the child is. Usually, takes sort of almost a round table. The three of us sit there and discuss it and work out the best option. And it's also one of those things, we may start with one certain treatment, and then that evolves as well. As a child
Mhm.
becomes more comfortable, becomes more confident, we can look at other options. And
Yes.
and that, again, technology is moving so quickly that new technologies will come available, new understanding.
Definitely. I think, and when you think about a child, once they start myopia control treatment, they're probably going to be on it for a number of years. And so, as you mentioned, it's going to change. It's a journey that they go on. For example, contacts might have not been an option when they're very, very young, but as they get older, it might work better with their lifestyle because they're more active playing sports. So it might be a better treatment option. And then other treatments might come out. There's always new developments happening. So it's a very much a long journey that the child and the parent and the clinician undergoes over, could be 10, 15 years or longer. So I don't think, it's very unlikely that you're just going to stick on one treatment, but it will sort of evolve and change.
Okay.
Mm.
Actually, there's a question for you. This is one that parents would always ask me.
Mhm.
Is they would always ask me, John, can't we just do laser for my child once she turns 18? Isn't that going to fix everything? I'll let you answer this one.
Look, the laser correction is just going to correct the blur that's associated with myopia. It's not going to do anything with the underlying progression, which is that accelerated eye growth that I spoke about earlier. And nowadays, unfortunately, with our lifestyle where we're very much screen based, even as young adults, whether they decide to continue with education and and different types of jobs or vocations where it's a lot of screen based sort of environments, we are, as we sort of spoke a little bit earlier, finding that adults do continue to progress in myopia as well. So the laser surgery is not going to do anything about that. And if anything, you might get the laser surgery, you develop myopia, so you're going to develop that blur again, because you've developed more of that myopia later on in life as well. So it's a great correction option once you know that myopia has completely stabilized. But I think until you're sort of in that space, it's not going to do anything with the underlying progression. And unfortunately, it's not going to cure myopia.
Yeah, actually, I think that's probably a bit of an underserved, hidden segment of the population. So these high myopes generally, they go and get the LASIK, in the adult years, and then they sort of drop out of the eye care system. But think about it, these people, they're highly myopic, the eyeballs very stretched. So these people actually need constant care. And it's probably a message that doesn't get out enough to that segment of the population. But as we kind of understand the risk profile of these people, we should be getting out to these people more, and for them to understand behavioral changes that need to be made and the routine eye care, because they're as much at risk as any of the others.
Yeah, I think it's just sort of the general public knowledge of myopia. Many sort of, I guess, are not aware of the underlying ocular health implications. So once you get laser surgery, your vision's corrected and clear, then, a lot of patients unfortunately just assume that they don't need that ongoing care. But as you rightly mentioned, they are at risk of other ocular health implications, which they need to be monitored regularly for. So I think it's a key role for clinicians to ensure that they do inform patients about sort of ongoing, risks and how to manage that, over the course of their life as well.
Mm. Okay, so we've discussed a lot of different topics, but you're sort of at the forefront of all of the research that's coming out. Are there any new areas of research that you find particularly interesting or compelling that you're sort of keeping your eye on?
There's more research sort of to understand how, our the environment around us, as we've sort of been talking about, affects or increases the risk of children developing myopia. So they've been looking at, for example, a lot of green spaces, access to parks and outdoor spaces, and how that might, increase or decrease a child's risk of developing myopia. So that's sort of a more interesting sort of part of research that's starting to come out, where they look at, for example, satellite images of, different urban spaces and seeing, whether, if you live in a certain area and you've got, how many parks within your vicinity, does that make you less risky or more risky potentially of developing myopia? So it's, now sort of going beyond not only the treatments of like glasses and contacts, but to really understand the visual sort of environment that you're surrounded by and how that might impact your risk of developing myopia.
Mm. And I think a lot of parents feel that as well. You know, indoor-based lifestyles, we're just on the screens, and
Mhm.
just getting out. Like we could sort of got to bring that back into our sort of everyday lives a bit more. So this is
Yes.
kind of segues into my final question for you. Yourself, a researcher, but also a mum. So how does the science change the way that you parent, and what does outdoor time look for you and your family, especially through Sydney winters?
Look, I do sometimes I just children do use screens. So, I do completely understand that sometimes, like with especially with education as well, going online and, some of the other benefits, I guess, of having screen access and sort of the things that they might be able to do on screens. I do try to limit that as much as possible, understanding sort of the risks of myopia associated with increased screen time. So we do try to, as a family, spend at least the weekends as much time outdoors if the weather permits. Um, in the bright sunlight, understanding that, they get the benefits of that. And even when we sit at home, we've got big windows, so I make sure they sort of sit near the window. So even if they're too cold to go outside, at least they might be able to experience some of that bright sunlight next to the window too. So, I try to, I guess, practice what I advocate for in terms of, making sure that we do increase or spend as much time outdoors as possible. Yeah, for my
Yeah, I
kids.
mean, some of that sounds exactly what I do, and I suppose we're both Mofa outdoor nerds, so we think the same. But I think that's a bit of a takeaway. You try to be consistent, and sitting near the windows, like you've mentioned, that doesn't take much extra effort. You're just sort of shifting yourself into a healthier environment, and that adds up, over the course of the week and the year. But also just knowing that, even though generally speaking, as clinicians, we say 2 hours outdoors a day, but we're sort of looking at in totality over the week, over the month, over the year. So we target 14 hours a week minimum. And then I found that, on the weekends, we could just sort of bulk up on that weekend and catch up, and we manage to do that most times. So, we get it, like parents are busy through the week, but classes and scheduling and everything else. But, it's a good time on the weekend, get outside with the family, spend it together. And it's got benefits for your eye health, mental health, your social well-being. There's so much to like about it. And that's sort of the mission behind, Bright July and what we're trying to spread awareness around, that, with just a bit of change that we can introduce healthier habits into the way we do things.
Yeah, no, I think it's a wonderful initiative that you're, pushing for, John. And yes, I think, yeah, it's just the little things and it all adds up. And I also sort of try to explain to parents, like 2 hours per day seems pretty daunting and a big task, but I sort of try to remind parents, think about walking to school, you're outside, or going to school, the child has recess, lunch, and all of those things actually add up. So it might only be an extra 30 minutes. During the school day where you might need to have the child outside if possible. But all of those little things, as you mentioned, they all do add up. So hopefully then it's a little bit more, achievable for parents, even if it's, cold and it's a winter's day as well. So, yeah.
Excellent. Okay, well, thanks, Pauline. Thanks for sharing your expertise and insights with us. And we'll hope to see you again.
All right. Thank you so much for having me, John.
Thanks. That's it for part 2 with Dr. Pauline Kang. Thanks again to Pauline for her time and expertise. Bright July runs through to August 2nd. Get outside, get your kids outside, and make it count. Brought to you by Luxy Health,